It's been a busy week. It feels like it's lasted a month, but it's only been 4 days. Yes, we had the inauguration, the grand inauguration on Monday. Thousands of people here in the Capitol. So it's always good to see so many of my constituents come to visit, come to celebrate the new election cycle, people in their finery coming here. It was quite an extravagant inauguration, and I was very proud to have my rabbi provide the benediction at the inauguration. So it was quite a day, and actually my rabbi and his wife and one other person, a committee man from Clayton, escorted me down the grand staircase. So we will have a nice picture as memorabilia from this exciting day. Wanted to talk about some of the other things that happened in this, what felt like a long week, but was just a filled week for so early in the session. The governor has issued, I think, 3 executive orders. I wanted to talk about 2 of them. One is that anybody in the Office of Administration will not be allowed to accept lobbyist gifts. So this ties in with the discussion around ethics that we've had. Now, you may recall that the governor received a Glock with his name on it and a Navy SEAL emblem on it. And my question is, will the governor be returning that as part of his desire to change ethics standards in Missouri? And he also issued an executive order that says no new rules will be promulgated, with a few exceptions. And if you need new rules, if the departments need new rules to be promulgated, that they need to send them through the executive office, which is a little bit unusual in terms of the fact of the division of responsibilities of government. But the concern I have, this was around economic development and not continuing to put in additional regulations that people feel might hurt our businesses and our Missouri economy. But there are some, what I think may be unintended consequences. Federal funds that come to Missouri to provide grants for victims of domestic violence and abuse, nursing home regulations, services for victims of crime, children's services. Some of these are in process of having their rules promulgated, may be time sensitive, and this new executive order may, again, as an unintended consequence, stop these things in their tracks, which means some people won't be served. So I'm hopeful that the governor will take those things into consideration as he moves forward or modifies his executive orders. I wanted to remind people again that a colleague of mine from the Senate and 3 from the House, all women legislators here in Missouri, are providing a weekly podcast called Heads Up Missouri. We went through a lot of name iterations, but that's the one that we came up with. We're all Democratic women, but we each give our different opinions, because we don't certainly always agree, our different opinions about issues that are coming up. And you'll be able to hear those weekly podcasts on SoundCloud. We will have different people come in as special guests for our panel to talk with. So I'm hopeful that you'll tune into SoundCloud for Heads Up Missouri. Wanted to talk about new security in the Capitol. So interestingly, in the past, people have said to me, gosh, anybody can walk in at any time. There's no security, which has been true. The only place that you needed your badge as a legislator to come in that I recall was through the House garage getting into the chamber. So legislators needed to have some kind of identity, but nobody else did. So now we've gone from that extreme to another extreme where we have, about $415,000 in metal detectors that have been put in so far. We have troopers and Capitol Police stationed in many places around the Capitol. I have a badge that lets me in without me going through any kind of metal detector or check, but members of the public will have to be prepared when they're coming to the Capitol to open their purses or their bags to, I think, perhaps show an ID, but I'm not positive about that. But we'll only really be able to get into the Capitol during certain hours by going through these checkpoints. And we have sent a list of questions to the Office of Administration to get specifics so that my constituents will know when they can get in, what they need to do, and how they need to be prepared. So if, for example, you're coming to testify at an 8:00 a.m. committee hearing, you leave plenty of time to go through those security checkpoints. Interested in knowing where these additional troopers and Capitol Police have been coming from, if they're new hires or what assignments they've been pulled from to put into place this new security, and really what precipitated this level of security versus a total lack of security prior. So those are some questions that we're working on trying to get answered. Wanted to talk a little bit about an ethics committee hearing that went on in the House on Monday morning at 7:30, a little bit earlier than most hearings take place, and especially on Mondays when, generally speaking, the legislature doesn't go into session until 4. So people that I know that serve on the ethics committee in the House said that there was nobody there to testify for or against. And again, these are public hearings, and ethics is important important to the people, certainly in my district and around the state. They want to have a chance to weigh in and provide their opinion. I know that some colleagues were talking about the dark money that has been utilized to give campaign contributions to legislators. We know that there's about $2 million out in what we call dark money. In other words, we don't know who sent the money to our newly elected governor. So we're hopeful that the governor will be willing to disclose the donors from whom he's received this $2 million in donations as a good role model for those of us who believe strongly that transparency in government is really critical. And as you may recall, I've been filing a bill in this arena for the last several years. So we'll look forward to seeing how that goes forward. We've also had hearings this week in the House and the Senate on so-called right-to-work legislation, or as some people call it who oppose it, right to work for less. What this legislation does, and it's being fast-tracked in both the House and the Senate by committee hearings already so early in session, my perspective is that this hurts a worker's ability to join a union, to negotiate contracts along the lines of salary, benefits, hours, and safety. And we have 10% of our employees in the state of Missouri are union members who have, over the years, learned that they work better together to go to the bosses and the owners of their companies or corporations to say, here's how we believe we should be treated. Let's work together to figure out what works for the company as well as for the employees. So we think that that legislation may pass this session, and we'll see what happens to the workforce around the country in the states where right to work, so-called right to work legislation has been implemented. The average wage from research I've done has been lowered by about $6,000 per year. So that's pretty significant for a working family. Also want to talk about a hearing, my first hearing on a committee that I served this year, Children, Families, and Seniors, Senate Bill 28, put forward by the chairman of the committee. This is a bill about Medicaid, or as we also call it in Missouri, MoHealthNet. My belief about this bill as it currently stands is that it puts funding at risk for us to be able to get matching dollars, additional dollars beyond 50-50 match. It's usually a 60-40 match from the federal government to help pay the providers for taking care of our very low income Medicaid patients, or for people who are on Medicaid because they are disabled, our seniors in nursing homes, and our children. If we don't have these dollars from the federal government because of this global waiver that we're requesting, if we have a limited number of federal dollars and more people join the Medicaid rolls, we're going to have a problem paying for those patients, which means either we pay more out of our Missouri budget or we don't provide services. And again, these are some of our most vulnerable people. And to think that somebody in a nursing home that is depending upon Medicaid to pay for her nursing home facilities may end up not being able to access funding because we run out. That's a real problem from my perspective. So we're going to work hard to make changes in that legislation. We had our hearing on it. It may be voted on soon. I'm hopeful that people that are listening will read Senate Bill 28 and weigh in. But I think there were two groups that testified in support of this legislation, and well over a dozen that testified against this legislation. And even with that, we think this bill will probably move forward and pass and be heard on the Senate floor. I'm excited to announce that Senator Schupp has allowed me to schedule a hearing in his committee. It will be next Wednesday, January 18th. Happy birthday, Mom, on January 18th. Next Wednesday at 10 a.m. on flu vaccines. So we have a piece of legislation that says, with minimal exceptions, if you are working in healthcare, that you need to be vaccinated against the flu if you have contact with patients. So most of our hospitals already have these rules in place, but not all healthcare facilities do. So when patients who are always vulnerable because they're either sick or maybe having surgery or suffering from an injury, when they come in contact with healthcare providers who may be sick, that just complicates whatever issue they're dealing with. People who are sick, whether they are sick with diseases or illnesses, whether they're preparing to go through surgery, for whatever reason they are in a vulnerable state, we need healthcare providers to not complicate that by coming to work inadvertently sick and having the flu. So these flu shots are preventative to support our patients in the state of Missouri. That's the impetus for this flu vaccination bill that will be heard. It was brought to me by a person who was a medical student at the time. Now he's a doctor. His name is Nick Semenkovich. So shout out to Nick for this idea coming forward from your work in medical school and now as a doctor. And that's it for this week. So it was a busy week, lots more going on, and we're sort of pointing out the highlights. Thank you for listening, and we'll talk to you in another week.